Welcome to my channel. Please like, comment, and subscribe. This is the next list of countries with universal healthcare system. The Netherlands. The Netherlands uses a Bismarck model of a mandatory health insurance for all. Patients often have copays and deductibles that they must satisfy. The next is Norway. All Norwegian taxpayers are part of the healthcare system, regardless of citizenship. Members of the healthcare system pay up to a maximum limit per year, at which point the government covers any other costs incurred. The next is Philippines. All Filipinos are automatically enrolled in the PhilHealth health system, which reimburses them for healthcare costs. Expats can also pay to join the system. The next country is Portugal. The nationally run healthcare system requires copays at the point of service. And Saudi Arabia, while Saudi citizens receive free healthcare, all expats must have private health insurance. The next is Serbia. Because it requires participation in the national insurance system, this is a country with free healthcare at the point of service for citizens, permanent residents, and even some temporarily residents. The next country is Singapore. Citizens and permanent residents have a mandatory medical savings plan and mandatory health insurance for catastrophic coverage. The government runs many healthcare facilities and also controls medication costs, which keeps out-of-pocket prices relatively low. And Slovenia. The national health insurance system here covers most costs, but residents and citizens have certain co-pays for care. The next is South Korea. All residents must pay into the national health insurance system, with a few exceptions. The country automatically enrolls residents after 6 months in South Korea. Residents also have copays whenever they receive medical care, but the cost to the patient is relatively low. The next country is Spain. Spain's Sistema Nacional de Salud is a beverage system like the UK's national health system that provides the country with free healthcare. Legal residents can register for the systems. Members get free doctor's visit. Services and procedures are done at no charge. The next is Sri Lanka. This is a country with free healthcare for all citizens through a government-run health system. However, due to current economic issues, the public health system lacks supplies and resources. The next is Sweden. Like Spain, New Zealand, and the UK, Sweden has a beverage system with state-run healthcare, but it is not free at the point of service. Most patients must pay a fee at doctor's visits, at the hospital, and for other care. If patients reach the maximum out-of-pocket cost for the year, they are exempt from co-payments for the rest of the year. And the next country is Switzerland. Like Germany, Austria, and other Bismarck system countries, all Swiss residents are required to purchase health insurance. They have a choice of deductible and also have small copays for most services. The next is Thailand. 3 public health insurance programs combine to cover all Thai citizens. For citizens of Thailand, healthcare is free at the point of service. Expats must carry private insurance. And Turkey. Through a national insurance model, Turkey provides healthcare for all citizens. Expats who have resided in Turkey for at least a year can join the national insurance program by paying a monthly premium. The next is United Arab Emirates. Coverage for citizens differs depending on the emirate. Abu Dhabi and Sharjah provide insurance for all citizens. Dubai provides insurance coverage to citizens that are not part of a government health program. Abu Dhabi requires employers to provide health insurance for expat employees and their families. Dubai requires employers to provide insurance for expat employees, but the employees must purchase insurance for their dependents. And the next is United Kingdom. The United Kingdom's National Health Service is famous throughout the world for providing free healthcare to residents and citizens. The countries listed previously have universal healthcare, defined as providing nearly 100% of citizens or residents with health coverage in some form. In many of these countries, employers and individuals share in the cost of healthcare through contributions. However, the goal of these programs is to provide universal care, which makes healthcare as affordable and accessible as possible for the largest number of people. Thank you very much for watching. Don't forget to give your like, comment, and subscribe.